pioneers in the musculoskeletal area,
Yeah.
like John Sarno, who started to say, hey, you know, that disc that you think is the source of the problem, or that stenosis, or that carpal tunnel, etc., etc.
Even the arthritis.
And the arthritis and all these pains may not actually be coming from that. And as the neuroscience came on, we saw he was right, that the pain isn't really in the body. Pain is felt in your brain, whether acute or chronic. But in chronic, there's something that happens with the pattern. What's so exciting about unified therapy is that we have, I really, really have seen it consistently and believe that we have a way to turn that off, to actually reverse or delete the negative experiences. And we're committed to getting this out to the world. It's not, as far as patients is saying, we're already at maximum levels, because it's so, when you have something that works so well, it's very hard to meet the demand. And so we're really interested in, at all costs, reaching out to all kinds of professionals and researchers alike to say, hey, just take a look at it. Now, it's very important about unified therapy. It isn't something completely born out of nothing. It's born on all the existing information. We don't negate any of that. All the things that came out of you know, already existing trauma and stress therapies and pain therapies, we build on it so everybody can include. But you understand, as yourself, you know, you're a practitioner, it's not easy, because you must have knowledge of all those different fields, and you must understand it from their perspective. And so that sometimes becomes challenging, but we believe information is so important as an overall tool to get these changes. And the other big thing which I want to say about the therapy is, like yesterday I had a patient come in, and he's 75 years old, and he says, you know, I'm having this neck and back pain, but I want you to know that I've been a yogi, I teach all over the world, you know. I'm a Swami, which is considered to be the high level teaching. And years back I used to come with this girl, Maria, and you know, she's also a teacher and Swami, and she works at MIT now, and she just praised what happened here. But I have this problem, and incidentally, I also have this digestive problem that I've had for 30 years. Now, I've been to I have this pain, unexplained, chronic unexplained pain, 30 years. I've been to every traditional physician, had all the workups. I've been to all the alternatives. I've done the Ayurvedic, I've done the acupuncture, I've done the nutrition. So I said, to me, believe it or not, that's exciting, because I'm always looking for that brain-body connection, and you know that when we open the doorway of the unconscious, it delivers us very important information. And what's so astonishing about unified therapy is that it crosses that border, which we've been looking since the very birth of the knowledge of the unconscious, going back to Sigmund Freud, that there was this conscious and this unconscious part of human being. And that the unconscious had a lot more to do with our lives than we ever thought. That was the basis of the way talk therapy, or the talking cure as they called it at the time, or psychotherapy was. And that if a person could understand that and get a grip on it, it would help them in their life. So Unified has found, which I believe, that amazing doorway, especially into the unconscious. And we've mentioned it before, we have two types of memory. That is explicit or declarative, and implicit memory or procedural. And it's very important to make a distinction, because in explicit or declarative, that's autobiographical. And when we're working with people, it's routine that people all of a sudden have these spontaneous memory recalls, right? And when they do that, we don't just want to go into the memory recall. What we're looking for is, to quote Antonio Damasio, a very famous neuroscientist, that a somatic marker. And a somatic marker is the brain's representation of the unconscious in the body. And it happens much quicker than anyone would ever get it in their head. And so as we're working and making these connections, these sensory connections, people begin to experience sort of memory recall. But to make it a successful intervention, we want to connect the memory with the body-based sensation. So if it's pain or in the stomach, etc. And the other type of memory is called implicit or procedural. And that's where we believe a lot of these adverse childhood experiences and stresses are stored. And implicit has no autobiographical recall, means you can't really say, well, that happened or remember this. It's just a feeling. And what makes implicit so challenging is that it's often as real as the first time you felt it.
So you're saying like during the session, people start to feel these sensations and feelings and memories. Now, how is it really done? Really, what's involved? What's the process? Am I sitting down? Am I laying
Okay,
down?
so we'll go through that. So let's just go back to that individual which we were just talking about, the 75-year-old. So here he comes with a back pain. He's been doing all kinds of meditation and mindful, it's a big word today, mindfulness-based practices and mindfulness-based, what does that mean, you know? So he's been doing all this, he's reached this, definitely, he is not your average 75-year-old, there's a certain vitality, there's an awareness, but nonetheless, he's stuck with pain, which all his tools isn't making a difference. It's become chronic, it's lasting more than 3 months, you know? And he has this other thing that's going on. So in the session, which was very interesting, as he connected to what we call the righting reflex or the homeostatic balancing reflex, which automatically dissipates the present stress and dumps what we call the allostatic load, and those are the stresses over a life, especially the ones that the ACE score is talking about. So you can see how phenomenal that is, because people used to think, well, this happened, that's it, I have to live with it, there's nothing I can do about it. And we're saying, no, human beings are a work in progress. We are always evolving, we are always learning. And if you look at the history of being on this planet, no matter what problem, whether it's technology, whether it's environmental, whether it's in health, human beings always have the capacity to figure out and develop, right? Whether it's in their own bodies or whether it's manipulating the outside environment, right? And so we're saying that ability to develop the brain, neuroplasticity, and create what we call LTP, long-term potentiation, is giving human beings in the 21st century new tools to deal with the present trauma and stress, but especially the old one. Because if we're getting this right about the ACE score, they're saying that, wait a minute, this is a major turning point in the understanding of the human dynamic, that if we can change that early stuff that we're exposed to, it's going to change us as an entire society, and it could lead to a period of great sort of change, almost like a renaissance or golden age. Because if you look at history, there was always this time where human beings had to move from a certain thing, whether they were food gatherers or protection, and they didn't have to worry about survival things anymore, and that the resources in the town, in the community, would be used for this great movement. And hence, whether it was art or literature or Greece, then that's what happened. Now, you can imagine, the #1 preoccupation in this country is dealing with suffering and disease. And so what if that was going to shift? What if we're saying that so much of the source, that is coming, right? On that ACE score, there's 100%, if you have a score of 4 or more, of the percentage of people are going to be antidepressants. It's like, whoa, wait a minute. That changes the perspective. I thought it had something to serotonin, and the new studies really question that.